If every step feels like you are walking on a bruise and nothing seems to fix it, there's a reason for it. And most doctors, they never talk about this. Most people who have plantar fasciitis, they stretch, they roll their arches, they use ice, yet the pain still shows up the moment they start walking again. But the real problem starts long before your foot ever touches the ground. And once you see it, you will understand why your pain keeps coming back over and over again. In this video, you're going to learn why walking hurts in the first place and why the usual fixes never last. I will show you the 4-phase approach of my step forward protocol built from thousands of patient sessions and advanced postgraduate training. This is not just a sequence of stretches. It uses therapies like laser, shockwave therapy, neuromuscular retraining, and alignment work so that the tissue can heal and the foot can finally go back to moving the way it's supposed to. You will also get 3 simple relief techniques that you can do at home to calm that morning pain, take pressure off of your heel, and make those first steps of the day more manageable. By the end of this video, you will understand what your foot is doing that keeps triggering the pain and what you can do differently so that you're not limping through the day. Hi, my name is Dr. Chris Cameron. I'm a chiropractor here in Lucan, Ontario. I help people with degenerative spinal conditions, low back, neck, knee, foot pain to overcome their pain, improve their health, and get back to doing the things they love, all through non-surgical corrective methods. On this channel, you'll find practical tips, insights on managing back, neck pain, healing disc injuries, and improving overall spinal health. Before we dive in, make sure to subscribe so you don't miss any new videos on how to strengthen your spine, enhance your well-being, and live a more effective, fulfilling quality of life. I upload a new video every week. Heel pain is one of those things that you don't really notice until it takes something away from you. That first step out of bed, the walk to the kitchen, even standing still for a moment can feel like you are stepping on a bruise. If you have plantar fasciitis, you know the routine. The sharp heel pain in the morning, the burning in your arch after a long day of work, and the limping everywhere you go. And what makes it so frustrating is how many different things you've already tried with no success. Stretching, rolling, new shoes, rest, maybe even injections, yet the pain still keeps coming back. When it follows you from morning to night, the pain affects more than your foot. It affects your mood, your confidence, and how you move through the day. Why? Most people think heel pain starts the moment the heel hits the ground, but the real problem starts earlier, before your foot even touches the floor. Your muscles are supposed to fire in a specific sequence to absorb impact and protect the fascia. When that timing is off, every step loads the heel the wrong way. The fascia takes a hit. That is why stretching or rolling feels good for a bit, but never changes the way your foot actually moves. And it is why the pain keeps coming right back the next morning. When the foot cannot handle the first few milliseconds of each step, the cycle continues. Understanding this makes it much easier to see how real lasting relief is possible, and that is where the 4-phase approach comes in. Over the years of treating thousands of patients with stubborn heel pain, a clear pattern started to show up. People were trying the right thing, but in the wrong order, or they were missing that one phase that would have made everything else work better. That is what led me to the Step Forward Protocol, a structured approach we have used in the clinic to help patients walk normally again, even after months or years of frustration. It brings the entire recovery process into 4 focused phases that work together instead of leaving you guessing, understanding why your foot keeps hurting, and finally opening the door to something that actually works long term. The Step Forward Protocol is built around 4 phases that heal the fascia, retrain the foot, protect your progress. Each letter in the name stands for a specific part of the recovery, and each phase targets problems that plantar fasciitis creates in the body. The S stands for stimulate recovery. Chronic plantar fasciitis often means the tissue is no longer healing on its own. So in this phase, we focus on jump-starting real repair. Therapies like deep tissue laser, focal shock wave, increased circulation, activate the healing process and shift the fascia from a degenerative state into one that can rebuild. This is where the pain and inflammation starts to settle down and the tissue becomes ready for change. The T stands for train. When the foot has been painful for months and the muscles and the nerves that stabilize the arch begin firing out of sync, this can create that morning spike of pain or that aching that shows up after a long day of work. In this phase, the goal is to retrain how the foot and the ankle communicate. Neuromuscular receptor training, balance work, and joint mobilization help restore coordination so that your foot can absorb the impact the way it was designed to. The E stands for enhanced mobility and alignment. Many people with plantar fasciitis have stiffness in the subtalar or midfoot, or their foot collapses inward when they walk. Over time, this overloads the plantar fascia and keeps the cycle going. This phase focuses on correcting those mechanics. Custom orthotics, specific mobility work, and targeted strengthening help the foot move the right way again and reduce the strain with every step. The P stands for protect. Once the foot begins to heal and move properly, the focus shifts to keeping it that way. This phase brings together supportive footwear choices, home care, and nutritional strategies to maintain healthy tissue integrity. The goal is to prevent flare-ups so that you can stay active and confident without relying on recurring treatments. Seeing these phases laid out makes the recovery process feel much more predictable, and it shows why quick fixes never last. When each phase is addressed the right way, the foot can finally return to normal function. Now that you know the protocol for long-term recovery, it helps to have a few simple things you can do at home to relieve that foot and heel pain. These are not meant to fix everything on their own. They are quick routines that get your foot working the way it is supposed to, so that each step feels a little easier and a little less painful. The first technique is the foot wake-up routine. This prepares the small stabilizing muscles in your foot so that they can support the arch before you take that first step in the morning. When these muscles switch on early, the fascia does not have to absorb the full load all at once. A simple way to do this is at home to sit on the edge of your bed and gently lift your arch, curling your toes. Hold the arch up for 3 seconds, then relax and repeat this 10 times. This switches on the deep foot muscles that support your arch before you stand up, so the fascia doesn't have to take the entire load of the movement. The second technique is the midfoot unlock mobilization. Many people with plantar fasciitis have stiff midfoot joints. Without realizing it, when these joints do not move well, the fascia is forced to stretch and strain with every step. This simple mobilization helps restore shock absorption and takes pressure off the heel. You can do this by sitting with one foot crossed over the opposite knee. Place one hand under your forefoot and the other hand under your midfoot, then gently wiggle the foot side to side as if you were loosening a stiff hinge. Slow motions work best. Spend 10 to 15 seconds doing this to help the midfoot joints move more freely so the fascia does not get overstretched with each step. The third technique is the first step protection roll. This is a small habit shift that prevents the sudden stretch and overload most people feel when they get out of bed in the morning. By giving the foot a few seconds of preparation, you avoid the sharp pain that normally greets you in the morning. Before you stand up, point and flex your foot 5 to 10 times. Then roll the ankles in small circles. This takes less than 10 seconds, but warms the tissue up and reduces that sudden morning stretch that creates a sharp heel pain. When the foot has a moment to prepare, the first step becomes much more manageable. These 3 steps fit naturally with the larger protocol because they prepare your foot to handle pressure the way it was designed to. This also gives you a sense of what it feels like when things start moving the right direction, which helps set the foundation for long-term healing. Once you start to feel how these small changes affect your steps, it becomes much clearer why some people finally get lasting relief and others stay stuck in this vicious cycle. Plantar fasciitis improves fastest when the foot is treated the same way it functions, in a sequence with structure and with the right support at each stage, this is where the full step forward protocol comes in. At home techniques can prepare the foot and reduce the morning sting, but the long-term fix comes from restoring how the tissue heals and how muscles fire and how joints move and how the foot handles pressure throughout the day. In my clinic, we use targeted therapies like laser therapy and shockwave therapy to stimulate recovery, neuromuscular training to correct timing, mobility and alignment work to reduce strain, and a long-term protection plan that keeps your progress steady. It is a complete system designed to help you walk normally again without surgery, without injections, or relying on endless quick fixes. If heel pain has been making you feel older than you are, slowing you down, or stealing confidence from the first steps in the morning, there is a clear path. You don't have to live with the pain or keep guessing what to try next. When you understand the real cause and follow a structured approach, your foot can rebuild the way it was meant to be. And if you want support putting a structure in place, or if you feel like you've already tried everything and nothing is really working, this is exactly what we do here every day in the clinic. You deserve to walk without guarding every step. You deserve more comfortable again. If you found this valuable, then go ahead and like and share it so more people dealing with heel pain can find the help they have been looking for. If you have questions about plantar fasciitis, drop it in the comments down below, and I will do my best to point you in the right direction. And remember to subscribe if you want to see new videos on how to strengthen your spine, enhance your well-being, and live a more active, fulfilling life. And if you are still not convinced that orthotics are not the complete answer to plantar fasciitis, go ahead and watch this video next. You will be surprised.